Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about Pap smear or Pap test. A Pap smear or Pap test is a simple screening test used to check abnormal cells in cervix. Or cervix means the opening of your uterus. It is usually used to check the abnormal cells in the cervix. Or in other words, it's a cervical cancer screening test. It helps to detect early stages. It helps to detect early changes that could lead to cervical cancer, often long before cancer develops. Let's look into why it is done. It detects precancerous or cancerous cervical cells, helps to identify certain infections or inflammations, saves lives by catching problems early when they are easily treatable. Okay. So, who should get it? General guideline for testing a Pap smear test is uh, it may vary according to the doctor. From age 21 to 29, Pap smear should take a Pap smear test every 3 years. From age 30 to 65, Pap smear every 3 years, or Pap smear plus HPV test every 5 years. Okay. After 65, may stop if previous tests are normal, but it depends on doctor's decision. Okay. What happens during test? The woman who are going to take the Pap smear test usually lies on the exam table. Doctor inserts a small instrument called a speculum into your vagina. Okay. A tiny brush or spatula collects cells from the cervix like a gentle brushing. Cells are sent to lab for testing. This collection of this collection of cervical cells only takes less than 5 minutes or 5 minutes. Now the question is, does it hurt? Usually it is not painful. Some women may feel a mild discomfort, slight pressure, rarely slightly sporting afterwards. So how to prepare for a Pap smear test? Generally, you should try to avoid these things in 24 to 48 hours, like intercourse, tampons, vaginal creams, or medicines. The best time to test the Pap smear is when you are not on your period. Okay. There is a question that if the person didn't undergo any type of sexual activity or any type of intercourse, the should that person need to test the Pap smear? In general medical guidance, the Pap smear are recommended starting at the age of 21, regardless of sexual activity. However, when coming to practice, doctors usually delay or individualize the testing if someone has never had any sexual contact or has any sexual intercourse, has no other symptoms, like has no other gynecological symptoms, has low risk of HPV. These factors, considering these factors, the doctors usually delay the testing in non sexually active females. They may discuss risk and versus benefits with you first. So, when you should see a doctor, you should seek a doctor's attention to do a pap smear test. If your screening is not due, when you should seek an attention. If you find unusual vaginal bleeding, bleeding after intercourse, persistent pelvic pain or lower abdominal pain, unusual discharge, these symptoms are alarming for you, so you should seek a medical attention as soon as possible and take a pap smear test. Okay, so let's wrap today's topic here. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.